Is heavy postpartum bleeding always a cause for concern? Imagine holding your newborn, feeling exhausted but happy, when suddenly you notice your pad is soaked in just an hour. That can be startling, right? Postpartum bleeding is common after giving birth, but how do you know when it's normal and when it's serious? That's what we're here to talk about. After birth, your body sheds the lining of your uterus, which causes bleeding called lochia. This bleeding is usually bright red and heavy at first, then gradually lessens over several weeks. It's normal to soak through 1 or 2 pads in a day during the first few days. But if you're soaking through 1 pad in an hour 4 hours straight, that's a sign to watch out for. Heavy postpartum bleeding, also called postpartum hemorrhage, is losing more than 500 milliliters of blood after a vaginal birth or more than 1,000 milliliters after a cesarean section. It can happen right after delivery or within the first few days. The main cause is when the uterus doesn't contract enough to stop the bleeding from where the placenta was attached. Other causes include retained pieces of the placenta, tears in the cervix or vagina, blood clotting issues, or blood collections called hematomas. If you notice large blood clots larger than a golf ball or quarter, that's another warning sign. Also, feeling dizzy, weak, or having pale, clammy skin, or feeling faint could mean your blood pressure is dropping. An increased heart rate is also a sign that your body is trying to compensate for blood loss. If the bleeding doesn't slow down or if it starts to increase again, seek medical help right away. It's normal to worry, especially when caring for a newborn and recovering at the same time. Keep track of how many pads you use and how big the clots are. If you're unsure whether your bleeding is normal, don't hesitate to contact your healthcare provider. Early advice can prevent complications like severe anemia or shock. Treatment depends on what's causing the bleeding. It might involve massaging your uterus to encourage contractions, giving medications like oxytocin, or removing any retained tissue. In rare cases, surgical procedures or blood transfusions are needed. Iron supplements are often recommended to help rebuild your blood supply after significant blood loss. To sum up, some bleeding after birth is expected, but heavy bleeding isn't always normal. Recognizing the signs early and seeking medical care can keep you safe and help you recover smoothly. As a new mom, staying informed and connected with your healthcare team makes a big difference in your postpartum journey.